Hi, Dr. Sheri. It's lovely, lovely to meet you. I think
Hi, Nikki.
for the benefit of those who aren't familiar with you and your work, please could you just introduce yourself? Who is Dr. Sheri and what's your story?
Okay, very briefly, I'm Dr. Sheri Prentiss, born and raised on the south side of Chicago. Always wanted to be a doctor ever since I was 2 years old. And that's what I did. I went on to become a doctor. Subsequently, in that career journey, I was diagnosed with breast cancer. Things kind of derailed my career. I had to reinvent myself, do something different. I decided, what did I have in my house? I had a big mouth. So I went ahead and became a certified speaking professional. That is the highest designation awarded by the National Speakers Association. There are less than 600 of us in the world and about only 400 of us that are actively practicing. So I use my voice now and I use my medical knowledge as a healthcare consultant. I consult with Fortune 500 and 100 companies, serve as chief medical officer and chief health equity officer. I've been in the field of health equity all throughout my medical career. Obviously, being a Black woman growing up poor, I know what it was like to experience and live through the social determinants of health. And I made up in my mind that when I became a doctor, I would come back to my communities and make a difference. And I am grateful to have the opportunity to do so, to have my own nonprofit, and now to serve as a global director for an international ministry doing this similar work all around the world.
That's incredible. And I just have to say, this was entirely unplanned, but I happen to be wearing my Chicago t-shirt today. I do love
It's
Chicago. Oh my goodness. It was perfectly timed. Divine.
awesome.
Yeah, oh, we love that. No, thank you so much for introducing yourself and your journey. And I'd love to explore, to the extent that you're comfortable, a bit more about your breast cancer journey. Like, what led you to finding out that you had it? Like, what were the signs? And yeah, how did you navigate that entire process?
It is so interesting because right before I was diagnosed, I had just helped two co-workers slash friends through the whole breast cancer journey. I mean, going to appointments with them, helping them pick out the oncologist, the radiologist, the plastic surgeon, all of that. And I had finally handed off the baton. I was done. This was the last person that was diagnosed. I could like woosah. My mom was terminally ill at that time. And so now I'm like, okay, now I can just focus on mom and get her straight. And actually, my mom was being transferred to inpatient hospice, what would be for the last time. And I was waiting for the call to let me know that she was there. And I was going to jump in the car, go see her, get her settled in. And I was on the call with my children's dad. And I'm multitasking. I'm a physician, right? So I'm talking to him. I'm waiting for the call from my mom. And it's October 1st. So I'm doing my self breast exam. And then I feel a mass in my right breast that I know was not there last month. I didn't feel it last month. And Nikki, it was like I knew, and I'm not a pessimistic person, but I knew this is cancer. And so I told my ex-husband, I said, okay, I gotta let you go. And I hung up, and then I get the call from my mom saying, I'm here, baby. And I just tell her, okay, mom, get settled. You sound real tired. I'll talk to you in the morning. And I immediately called the breast surgeon that had done my two friends' surgeries. I called her at home because by this time I have her home number, her cell number, all of her office numbers. And I called her and I said, Barb, I felt the mass. Tell me, are we going to do a diagnostic mammogram? What we're doing? And that was how I found out. And it was life changing because I'd given the diagnosis to so many people. And then now I had become patient. And I went through a partial mastectomy where they removed half of my right breast, 15 rounds of chemotherapy. I lost hair everywhere. Everywhere where there was hair, it was gone. So, no shaving of my legs and underarms. That was a benefit. You lose every strand on your head, your eyebrows, your eyelashes, and you have to look at yourself every day. It is, woo, honey, it hits you. And then 33 treatments of radiation. So my journey was long. And then shortly thereafter, radiation, another disabling disease occurred. Yeah.
Thank you so much for sharing that with me. And goodness me, I think you just put it so beautifully and powerfully. And I'm curious about that personal experience of going from physician to patient. Like it sounds like it was a really, really difficult time for you. How did that feel for you?
It felt surreal. I felt it's like I had to catch my mind from running too fast because there were certain things as a physician I knew. There were certain things that I knew if the biopsy turns out this, then it's most likely that. And so I'm trying not to have my mind race ahead of the next step. That was one. Two, I had to force myself, like any other patient, not to try to go to Dr. Google and not freak myself out. I had to not do that as well. But I also had to specifically tell each of my doctors, please do not treat me like a colleague. I am a patient. Because, like I stated at that time, my mom was terminally ill. So I'm the executor of her estate. I'm the only doctor in my family. Everybody has every expectation that anything medical clinic, everything that was about my mom was my responsibility at that time. And then now I'm recently divorced. So I'm, parent to these two young teenagers or preteens rather at that time. So there was all of this. And I said, my mind is going a mile a minute. Please do not treat me as a physician. Consider that I know nothing and I need you to treat me as a patient. That was difficult to give up that control, but I needed to in order for me to emotionally handle it all.
Oh, that's powerful. The way you just put it in terms of speaking with your colleagues to treat you as a patient rather than an equal in that sense. And yeah, it's giving me so much to think about because I do have friends who are doctors themselves, and I sometimes do wonder how does it feel when you are the one who is in need of care, because the carer needs caring. And so I would love to hear more about how the cancer journey went for you in terms of the chemotherapy and then all the way through to the point where you discovered lymphedema.
Okay. Well, as I stated, I did have a partial mastectomy and I did have the 15 rounds of chemotherapy and I did have the 33 treatments of radiation. All throughout that period, I only missed 3 days of work. That was the 3 days that I was in the hospital for the surgery. After that, I was program medical director for occupational health and employee health for the largest healthcare system in Illinois. I was overseeing 22 different facilities. It was very difficult to hand off that type of responsibility. And there was no one else within the entire organization that was board certified in occupational environmental medicine. So technically, no one could do my job the way I could do my job. So only took off 3 days of work. So I'm working throughout all of this through Neupogen injections and Neulasta injections because my white blood cell count is low and being tired and hitting that wall at 2 p.m. on those radiation days, you're just exhausted. The burns to your breast and your nipple and the discoloration of your breast, your arm, everything, all of that. And then finally, I get done with radiation. Ding, 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 they ring the bell. And Nikki, literally within 30 days, I want to say 2 weeks, I see this swelling. And I just happened to just be casually looking. Hey, my hand, my right hand looks bigger than my left. I think it is. So I reach out to my doctors and I said, hey, you know what? I couldn't see it as much in my arm and my upper arm, but definitely my hand and my fingers. And so I tell them and they say, hey, go to physical therapy. When I go to physical therapy, this is literally what was said to me. You have some what's called cording under your armpit where we remove the lymph nodes. That's really just scar tissue, technical term for scar tissue, and some swelling in your arm. So I went through physical therapy. They did certain manual lymphatic drainage, certain massage. It kind of taped my arm a little bit. I did that for about a couple of weeks, and the swelling appeared to resolve. Still seemed to be yeah, maybe a little bit in my fingers, but for the most part, I look normal again. And so they said, listen, if you're going to keep exercising and traveling, we want you to wear these garments to make sure this swelling doesn't get worse. And a year later, that's when, again, I'm now back into the full stream. I'm doing my work. I'm seeing and I'm seeing me, but this is how we can lose track. We get so caught up in getting back to our normal that even though I saw the changes that my arm and my hand were going through, I continued to try to press through it. But now swelling is bad. I go back to my breast surgeon. I said, I can't function like this. She says, Sheri, first time I'm hearing the word, you have lymphedema. But she didn't just assume that it was just lymphedema. She actually worked me up for secondary cancer because it was that bad. She wanted to make sure that there wasn't another mass that was blocking my lymphatic system and causing this swelling. And as it turns out, no, there wasn't another cancer. I just now had chronic, disabling, debilitating lymphedema that now there was no chance of it ever going away. And I had to endure 4 months, 4 months of physical therapy daily, Monday through Friday, only to at the end of the 4 months say, this is your new baseline of swelling. You're going to have to wear compression garments during the day and special garments at night. And unfortunately, this is something you'll have to live with for the rest of your life. And you can't practice as a doctor because the swelling is so severe, it is disabling you from the clinical functions of a practicing clinician.
Ooh. I'd love to learn more about what lymphedema is, how it manifests, and its impact.
Okay. Lymphedema is really swelling because of a buildup of lymph fluid. Our lymphatic system helps us to control infection, inflammation. It's part of our immune system. Where your lymph nodes can become, they're spread throughout the body, and they can become damaged by cancer, surgery, chemotherapy, radiation. I had them all. And so, with all of that, the lymph nodes on my right side were completely damaged. So, I ended up with severe swelling, painful swelling in my right arm, hand, and fingers. So, anyone who has damage to their lymph nodes is at risk for developing lymphedema, where it can cause severe permanent swelling that can be painful and can cause symptoms like numbness and tingling, a heavy sensation in the extremity, a tired sensation in the extremity. Even if you're not seeing swelling, it can feel tight, feeling like your skin is about to pop, or feel just very heavy and very tired, and you can't use that limb like you use the other limb.
Wow.
And it occurs in stages, 4 stages, 0 to 3. So 0 and 1 are stages where it's irreversible, where if you have this detected, you can have simple in-home intervention, and 92% of patients can go on to not develop chronic disabling lymphedema like I did. But you got to know that you have to be monitored for it, properly monitored for it, so that you can get in stages 0 and 1. By the time you see swelling, you're at stage 2 minimum. By then, it's chronic. There's no reversing it.
Thank you for sharing that. This is not something I've heard of before, and so I'm curious about the impact that it had on you. I think you mentioned it was told that this is something that you're going to have to live with and it's disabling, and therefore you can't practice what you've, worked hard to achieve your whole life. And something that I imagine you're very proud of. Whereas before being told that, you were trying to get back to life as usual. And I think so many Black women, especially, we always are putting on our capes or trying to put them back on too quickly. And I've experienced similar myself. And so I would love to hear more about it. How did you process the emotional side of things and the impact on your well-being and sense of identity?
I will honestly say, and I have shared this before, I tell audiences all the time when I'm sharing my story, I would love to give you the testimony that I said, I had faith And I prayed, and God gave me strength. You know, I was depressed. I went through depression. I was scared. Now, my only means of supporting my children and what I wanted to do all my life, I never tried to do anything else. I went through the plan. I went through, and I was an honor student the whole way, graduated valedictorian, cum laude. I did all of that to be a doctor. Now, all of a sudden, I'm 40, 41, 42, and now I have to figure out something new to do with my life. And I'm recently divorced. So, see, now I got all of these body image issues. I got scars on my body that were never there before. My hair is not as long as it was before. It's coming in a little bit differently. Some say it's cute, but I got to get used to it. I got to get used to this arm. Everybody is now asking me about these garments that I'm wearing. Okay, so now I'm trying to move forward in my life, but every day, every single day, and every single night, I have to put on these compression garments that are constantly reminding me of my cancer journey and of my present journey, that I now have to live with this all of my life. And now when I step out of the door, people are asking, did you get burned? Is that carpal tunnel? Are you a boxer? I got all kinds of questions. But fortunately, I have the type of temperament where I don't wear my problems on my shoulders. If I'm going to cry about it, I'm going to cry about it by myself, or I'm going to find my internal tribe. And so what I did was I used it as an opportunity to educate people. And I'd make a joke. I'm like, oh, no, but I feel like knocking somebody out now. You know, if they ask me if I was a boxer, and I would explain my story. So now I'm educating them on breast health, whether they were a woman or a man, because men can get breast cancer too. I'm educating them on lymphedema and what can occur, and how the insurance industry was letting us down, and healthcare individuals, even physicians like myself, weren't talking about it, and how I was using this now as a platform to make people aware. And so now I saw this as an opportunity to help others, but I still had to process emotionally myself. And in order for me to get through, I had to develop the right coping mechanisms. I had to acknowledge my pain. I had to look myself in the mirror and say, I'm not fine with this. Yes, I'm finding a way to reinvent myself, but how do I let go of all of that desire, all those years of training? Do I just let that go? How do I blend it in? And fortunately for me, over these last 15 years, 16, 17 years, I've been able to now do what I've always wanted to do my way, and that's blend medicine and ministry. But that took time. And we as Black women need to understand, we get the title of queen all the time. But true queens have courts, honey. They got people taking care of them. We don't have those courts taking care of us. We need to work within our tribe, but we need to express our real emotion. And that was hard. That was hard. How do I get into an intimate relationship with a man when I got all of these scars on me now? I got to put this garment on. And honey, the nighttime garment, I call it my oven mitt. It looks like an oven mitt. Your fingernails are out and you come all the way up to here. And so I would always joke with women. I would say, okay, so listen, honey, when I put on that nighttime garment, I said, when I get a boo, I'm gonna have to look him in the eye and I'm gonna say, something happening right now. Cause when I put this on, you out of luck. But it's simple things like that people are not even thinking about. Your doctors are not thinking about. If they don't have lymphedema, they're not thinking about it. So it was a journey.
Wow, thank you so much for sharing that. Yeah, I'm learning so much about not just lymphedema, but the extent to which it can completely flip your life. One thing I did want to say, very, very seriously, is that your hair is beautiful. Like, that is the first thing I noticed when you logged on. So I just have to get that out there. Like, your hair looks amazing. You look amazing. And to continue the conversation, I think when something really traumatic happens, there's often a degree of grief that comes with not just having gone through what you've gone through, but also, I guess, the identities that it robs you of It feels like the identities, the dreams, the versions of yourself that you feel you may never ever be again. And so I'd love to hear how you dealt with that grief of who you used to be and who you thought you were going to be, and how you journeyed to accepting where you were and becoming who you are now.
Well, it's interesting that while I was going through chemo, I developed crushing chest pain and subsequently was diagnosed with what they call an anomalous right coronary artery. It's a rare congenital disease, occurs in less than 0.25% of the population. And you can either live with it all your life, never know it. You can have a sudden massive heart attack, or you can have a sudden massive heart attack and immediate death. And so get there, cardiologist tries to put in 22 different size stents. None of them work. So he puts me on a handful of medication, sends me on my way. 4 weeks after discharge, now keep in mind that this is only after my third round of chemo. 4 weeks after discharge, my mom dies. And so now there's this whole insult. Okay, wait. Okay, so I still got to go through chemo. I'm battling that. I've made the commitment to my daughters. I'm going to make this fight. I love you. I'm going to be here for you. My mom dies. And then now I got this rare heart condition that I have to live with, where there is this threat of another massive heart attack with immediate death. And so that was a lot to process. And I realized I could not do it on my own. I am a woman of faith, was brought up in the church all the time and surrounded by a whole bunch of church folks that kept telling me just have faith. But I knew that faith without roots is dead. So I went and got my treatment. And then I knew I couldn't do this on my own. So I found a great Christian counselor that worked with my personality so that I could talk these things out, to recognize that this new normal or going back to normal and using even the word normal, what does that mean? And sometimes for some people, they have to take it out of their vocabulary because it means that where they are now is less than where they were before. And so I tell and remind people, and I had to get to this place myself of appreciating. Again, I'm faith-based, so people may deal with it differently. But I got to a place where I appreciated that there had to be some purpose to my pain. And sometimes you have to look for it. It may or may not just reveal itself. I had to look for it because I had to accept I'm living. I'm living for a reason. There were a couple of bad things that could have taken me out, the cancer and the heart condition. I lived through them for a reason. Why? I got to do something with this. My children are counting on me. My dad, who's still here, is counting on me. There is life for me. I'm still 43 at that time. So, Lord, what is it that I'm supposed to do? And so now, with becoming the national spokesperson with Susan G. Komen, becoming a certified speaking professional, I'm seeing so many other women walking around with swollen arms, and they're wearing the new colors that doesn't match the skin color. They're walking with their heads down. When I ask them, well, what is that? Why are you wearing the garment? I just want to make sure they understand why they're wearing it. And some of them were still saying to me, well, my doctor said I had some swelling, and so he told me to wear them. I said, have you ever heard of the word lymphedema? Nah, maybe. So now I realize, okay, this was a pain I did not want to go through. But now I can tell the story very differently. Having been a patient and a doctor, I can tell this story very differently. My degrees and all of my certifications open doors for me. So I allow now those open doors to now share a message of life, health, and healing after a breast cancer diagnosis, after a lymphedema diagnosis, how you can prevent a lymphedema diagnosis, and how you can recognize and find the purpose in your pain, because there is a reason for it. It is there to strengthen you, not to destroy you. That's the place where I had to be.
That's so powerful. And just hearing you speak reminds me of my own journey with anxiety and depression, and overcoming traumas of my own, and obviously not to the same extent that you did, but I also felt this sense of needing my suffering not to be in vain. And that's actually what birthed Bounce Black, and the work that I do. And I'm now 5 years into this thing, and It's actually been a means through which God has healed me. So I completely resonate with how you've described coming to terms with those things that you wouldn't never have chosen for yourself. But in God's wisdom and his providence, we find ourselves in these situations. And the way I put it is, sometimes what we feel is rubble in our lives is a resource in God's hands. And I think I think that's
I'm
exactly
right now and down. Resource to rubble
yes,
or rubble to resource. Yeah.
resource. And I think that's exactly what I'm hearing as I listen to you speak, very, very powerfully, because you have an incredible perspective of both the physician and patient side. And I think that's quite a rarity, I can imagine. So I'd love to talk about uh, lymphedema being something that isn't widely discussed within the cancer conversation, breast cancer conversation. And I'm curious as to why you think that is, and are there any disparities racially when it comes to these conditions?
Okay. Well, in general, I believe the conversation around lymphedema is not occurring because we get stuck in our norm. We get stuck in a cancer protocol, and then we can't seem to get ourselves out of it. For decades, the focus has been on extending life and finding cures. That's what the focus has been. We're not so much at the cures. Oh, but extending life for various forms of cancer is there. And we're so happy with that that I think we're not thinking about, well, if the people are living longer, how do those lives look? Because we as physicians know that the treatment causes certain side effects. It causes certain complications or can cause certain side effects, can cause certain complications. And so, therefore, if we know about them and can prevent them, we should. But that's not what we're thinking. It's almost as if we're leaving patients with, well, we make you're living longer. First of all, you're living, and then you're living longer. But we as healthcare professionals have to take that thinking further and say, how are they living? If I, as a physician, know that 82% of breast cancer patients will be affected by lymphedema, they are affected. That means the majority of breast cancer patients will be affected by lymphedema. Then our thought processes need to shift. That becomes part of our prevention and treatment plan. Part of our treatment plan should be to prevent that if I already know that the majority will face it. And so there has to be a shift in this conversation and the expectation that your patients will live. We got that now. They're going to live and they're going to live longer. Now it should be our responsibility with this knowledge. How can we help them live the best lives possible? Because if we don't, all we're doing is still feeding the healthcare system with more healthcare claims because now we're treating one condition, increasing their survivorship or their survival, but then causing another chronic condition that they'll have to live with for the rest of their lives. So we have to shift our thought processes. And with regards to certain racial groups, absolutely. Black women are disproportionately impacted by breast cancer lymphedema, by breast cancer related lymphedema. There's one study that shows there's a 3.5 increased risk for Black women over white women. Another study shows that being Black is like a major significant predictor of getting lymphedema. And then another study just pointed out, well, you know what? Black women are usually diagnosed at later stages, which could be leading to the need for axillary lymph node dissection, which places them at an increased risk for lymphedema. But I also challenge that by being diagnosed at a later stage, also probably increases the risk that their lymph nodes have been already impacted by cancer. And therefore, they're already set up for lymphedema. So it's multifactorial. The social determinants of health, access, employment, poverty, education, all of that. If you look at, pick a disease, we pretty much are worse. And that's the reality that we're facing. But we as Black women need to understand Keep that number in your mind. Black women, 3.5-fold increased risk of breast cancer related lymphedema after an axillary lymph node dissection. That means, Black women, I need you to go in with your mouths open at that very first appointment where you have been told you have cancer and we're going to discuss your treatment. Your treatment should include monitoring for lymphedema. Don't stand for anything less. Has to be. Yeah.
That's powerful. And on that note, I did want to ask for Black women, as is often the case, late diagnosis for many conditions, as you rightly acknowledged. Well, are there any particular early warning signs, like in general, that Black women can be aware of? Because I know you probably have the benefit of your medical insight, so you know when something is off. But for those who in the day-to-day course of action, Black women wearing our capes, we might neglect ourselves and not pay attention. So what are the signs that Black women need to be aware of?
Okay. Great question. And if you recall, when lymphedema first showed up in me, I told you, I said, I just kind of looked down at my hands and noticed a little swelling. Um, but it had been creeping up and I missed it. And here's why, because lymphedema, again, can show up before you even see any swelling. It can show up with that heavy sensation. You can feel numbness and tingling. That can mimic neuropathy. And many women get neuropathy as a side effect or a complication of receiving chemotherapy. And so if you're having these symptoms, like me, I'm a doctor, but I was a patient at the time. I'm like, oh, my neuropathy, oh, I may need to increase my gabapentin. Little did I know, lymphedema was creeping in. So because you cannot go by what you are feeling, okay? And because by the time you see swelling, it's too late to reverse it. You must be in a lymphedema monitoring program so that you can get detected in those stages 0 and 1, where a clinician can put you in compression garments for a 4-week period of time, or whatever the in-home intervention is. And now you don't develop the disabling lymphedema. That is the best way. I instruct every patient. I don't care about your color. Do not rely on symptoms that you may feel, especially not the ones you see, because by the time you see it, it's too late to reverse it. Get into a program that will monitor you specifically with bioimpedance spectroscopy. That is the top of the line, the best way in order to detect it early and save you from having to go through what I did, reinventing myself, changing my career, that fear of loss and the way people look at you. Don't do it. The power is in your hands.
That's amazing. And yeah, it's really important to nip things in the bud and be proactive. Um, that's really helpful to know. And so to kind of circle back to the impact that it had on how you saw yourself and the direction in which you took your life, I wonder if you can share perhaps any advice for someone who's going through what you were going through back then. Can you give them like the benefit of your hindsight and just some words of encouragement for reclaiming your sense of self?
Absolutely. One, I want every woman and or man that may be listening, reading this, to understand and appreciate that if you receive a cancer diagnosis, you've determined in your mind that you are going to get treatment. And our reasons for accepting treatment, going through treatment, are various. Some of us do it for our children. Some of us do it for us. Some of us, usually though, we as Black women, we're doing it for our families. I mean, the first thing we think about, if I'm not here, who's going to take care of the babies? What's going to happen to my husband? That's what we immediately think. We're doing it for other people. But although you may choose to go through treatment in order to be here and take care of your family, I need you first to appreciate and expect that you will live through this. You will get through this. Everyone's journey will be different. I have a friend who went through chemo and she said, I don't know what y'all was talking about, but I did not lose my appetite. I was not nauseated. I gained weight while I was on chemotherapy. So everybody's journey is different, but I need you to appreciate that you will get through this. And because you will get through this, as difficult as it may be going day through day, day after day in treatment, I need you to see ahead of that, not to long forward to the point where each day becomes a drudge. But I want you to think, if your treatment is lined up for 10 months, I want you to go ahead and think of, what am I going to look like in 11 months? Not physically, but internally, spiritually, emotionally. Begin to work on your healing immediately. Don't wait until it's all over, because when it's all over, now all of a sudden you had all of this new activity. You're going to doctors, you're meeting other patients, you're meeting, physicians and nurse practitioners. You develop like a whole nother new life while you're going through treatment. And then ding, ding, then ring the bell, and then poof, that life is over. Now everybody's expecting you to go back to normal, but you don't look normal, you don't feel normal. Because again, you went through the process, but you weren't preparing yourself for that moment that was sure to come. The survivorship moment is coming for you. So prepare for it. Mentally get the help that you need. Get the counseling that you need. And again, like I stated, at that very first appointment, I don't want any other woman to be impacted by lymphedema and have to be derailed. It's not just if you're a physician, but if you're a nurse practitioner, if you're an esthetician, if you do hair, anything that you require using your hands could wipe you out. And I'm sorry, in this present economy, you do not need that. So I need you to do this at that very first appointment. Know that you will live. Plan your life like you will live. And know that you get diagnosed with breast cancer, it's very likely that you will be affected by lymphedema. So in order for it not to derail you, you ask these three immediate questions. One, do you have a lymphedema monitoring program? Two, what do you use to monitor lymphedema? Particularly, do you have a SOZO device where I can measure my LDEX score? Because that's the best way. A way to determine, Nikki, do you know that it can detect less than 2.4 tablespoons of fluid difference between the affected limb and the unaffected limb? That in and of itself is just mind-boggling. That's how you can get in and now get the intervention you need and not develop chronic disabling lymphedema. And the third question is, how long do you monitor? Lymphedema can occur up to 3 years or later. So you want to know within this institution that you are submitting your care, your livelihood, your survivorship to. Make sure the institution you choose to treat at can monitor you for lymphedema and have the expectation that you will live and not just survive, but thrive.
Whew, that was so powerful. And how can communities and families, organizations, how can we support people going through these things? What in hindsight, what did you find useful? What didn't you find useful? And what did you need so that we can be proactive going forward?
For me, I found that a lot of my co-survivors, they weren't really caregivers because I care for myself. I was still caring for my mom and my dad while I was going through chemo and my treatment. But my co-survivors, those people around me that said, hey, let me know if you need anything. I'm here for you. Okay, so first of all, I'm going to tell you as a patient, don't let people get away with saying that. Soon as they say that, say, well, you know what? With my chemo, I have absolutely no appetite, but my children need to eat. So when you sliding through on Friday, if I can have your commitment that on Fridays, you're going to swing by and get them X, Y, and Z so that they can eat, so that I don't have to cook, that would be great. For those of you that are caregivers and co-survivors, after you make that statement, say, hey, you know what? You don't need groceries every month. Give me a list. And I had a dear friend to do this. Dr. Lisa Parker Davis, oh my God, that woman came through for me. She literally said, and then this is a woman who had just came through treatment for melanoma herself. pregnant and with kids. Her, as a co-survivor, said, I know you need groceries. So give me a list of the things that you normally get. And I'm coming through every month and I'm bringing you groceries and I'm bringing you food. And she packages it up so that the kids could take it out the freezer and have it there and immediately eat. As a caregiver, a person that is going through this a lot of times may not know what he or she needs from a physical standpoint. And so understand and appreciate bills still need to get paid. Kids still need to be fed. Kids may still need to get to and from school or after school programs. Just think about that person's life. As close as you are to them, you know what they have to deal with. If you're not close with them, ask them, what in your day can I take? I'm willing to take it on. Don't give the blanket, let me know if you need anything. But we as patients need to speak up. Again, we as patients need to get out there and voice what it is that we need. And as caregivers, you know of additional resources, start looking out for your loved one. Oh, you know what? Let me see if there's anything, a cancer support group somewhere in the area. Let me see if there's a, you know what? I heard about this organization, the Live Today Foundation. They actually, my mom was just diagnosed with lymphedema. We can't afford the compression garments, but I hear this doctor, Dr. Sheri Prentiss. She had lymphedema and she started this nonprofit foundation called the Live Today Foundation. They provide free compression garments to under-resourced cancer patients living with lymphedema. Let me reach out, go out to that website, and now let me fill out an application. Look for other resources to help them and admonish them. This has taken a toll. You need to talk to somebody about it. There's nobody that gets a cancer diagnosis that is strong enough to fully cope with it and never fully have an opportunity to express it, cry about it, talk about it. If you've held it in, you have not dealt with it, you've lived through it. There is a difference. Only when you deal with it can you really reach back and help somebody else. Because not dealing with it, you're not able to help them to deal with that emotion because you didn't deal with it. You just simply lived through it. And I'll say this, my organization is called Live Today, simply because when I came through my heart condition and after my mom passed and I'm working through what in the world is going on with my life right now, I heard the voice say, live. And in my mind, I thought, well, that's what I'm doing, clearly. You wouldn't let me die with the whole massive heart attack thing. But then over time, over a matter of a course of a couple of weeks, that word live had new meaning for me. And it became love yourself and others. Inspire those around you. Voice your dreams and ambitions and enjoy life today and every day. Nikki, that is my purpose. And I didn't find it until after my breast cancer diagnosis. Pain has purpose.
Chills. Thank you so much for sharing your story so beautifully. I think what I'm getting from this is for people who are suffering or people who are on the patient side of things, they should be proactive about caring for themselves. And then people who are onlookers or supporters, they should be proactive about caring for that person. And so, thank you so much for sharing beautifully about your story, your journey, and just how you've reclaimed your life and didn't let it end with these experiences. I'm like really emotional right now, but I'm
Hey.
very inspired by you and grateful for your life and for your work. And yeah, I would love for you to share how people can find you, get in touch with you, anything that you'd like to say.
Okay. Well, if anyone wants to find me, as I said, I'm a certified speaking professional. My professional website is drsheriMD.com. That's DRSHERIMD.com. My nonprofit, which is a 501c3 nonprofit organization, is the Live Today Foundation. You can go out to live-today.org to find out more information there. And I just would like to tell anyone that reads, hears, however you put this out, Nikki, every cancer institution, every doctor that takes care of cancer patients, anyone that has contact with a cancer patient, you have to prepare them for the possibility of lymphedema. That changed my life, and it served as a benefit to others because of the voice that I've been able to lend to it. But please don't let my voice go to waste and allow yourself to be impacted with lymphedema when you can avoid it. Get out there, find an organization, an institution that uses ImpediMed's SOZO device with LDEX. Just get monitored. It's going to become a part of your regular treatment routine. Get monitored, get tested, get intervention early if you need it, not have to go through chronic lymphedema. And if you are a cancer organization or institution or patient navigator, advocate for getting this type of testing in your institution so that 92% of breast cancer patients won't have to go on and completely derail their lives by allowing the treatment of one disease and being called a cancer survivor doesn't lead to you being called a chronic lymphedema patient for the rest of your life. And live today and every day. You have the possibility of doing that, and you can do it best without lymphedema. Trust you me.
Thank you so much, Dr. Sheri. It's been wonderful speaking with you. And again, I'm so inspired by your story and your journey. And yeah, I'm really looking forward to sharing your story and the lessons that you've shared today. So thank you so much again. Really appreciate it.
Nikki, my honor. Call on me anytime. Do you hear me? I love that you and I have a message. Our pain brought purpose. And I'm here because of your pain. I got to be and talk to you because of your pain. So reach out anytime.
It's powerful. Thank you so much.
Blessings to you.